Hello everyone, welcome back to my channel. I am Ada. In today's video, I would like to introduce Dr. Cliff.
Hello.
Dr. Cliff is my husband. He is a general and thoracic surgeon. He is the assistant clinical professor of surgery at Loma Linda University School of Medicine. He's a past president of the American Cancer Society, California Division, and he's currently the president-elect of Nigerian Physicians in the Americas. He's involved in medical missions worldwide, especially in our home country, Nigeria, where he goes back a couple times a year to give back to our people. He also does a lot of health teaching for various organizations such as churches, community groups, and nonprofit organizations. So he has a wealth of important health information that I believe will be very helpful to everyone. I'm also a nurse by profession, so I'm going to partner with Dr. Cliff. Together we'll be bringing you health information on this channel once a week. Today's topic is colorectal cancer because March is Colorectal Cancer Month. So Dr. Cliff will answer some questions about colorectal cancer that may save someone's life. So stay tuned. And if you just came across my channel, subscribe and turn on your notification bell so that you can be informed when we post these videos. So without further ado, meet Dr. Cliff.
All right. Hi. Thank you for having me on your YouTube channel. Glad to be here.
So Dr. Cliff, we'd like you to answer some questions like I stated. So I have a few questions that I will ask you, and you just give us your professional opinion.
Okay, let's do it.
The first question is, we want to know, what is colorectal cancer?
Well, colorectal cancer is a disease of the colon and the rectum. The colon is the large intestine, our large part of our intestine. Of course, the rectum is the last part of it that connects it to the anus. So you may hear of colon cancer, but actually it's colorectal cancer, which is an abnormality of that part of our digestive system.
Is that it?
Yeah, that's it. I
Okay.
mean, I can give you some statistics if you want.
Okay, just hold on.
wait.
I have more questions. Okay, so what are some of the risk factors associated with colorectal cancer?
Well, I think it's important to put in context, first of all, that colorectal cancer can affect both men and women.
Okay.
And actually, according to the American Cancer Society, this year, 2023, there's going to be about 150,000 cases. And sadly, about a third of it, 53,000 of those cases will die, which is why it's important that then we know our risk factors and we screen to try not just prevent colon cancer, but to find it early when it's treatable. So to answer your question specifically, risk factors, age, now it used to be 50, but now 45 is the new number, age 45 and above. Other risk factors, if you have a personal history of colorectal cancer or a family history of colorectal cancer or polyps, which are little growth, which is where most of the cancers start from. People who have inflammatory bowel disease or IBD, such as Crohn's disease or chronic ulcerative colitis at higher risk. Also, these genetic syndromes we call FAP syndrome or familial adenomatosis polyposis syndrome, just a bunch of polyps in the colon, is a risk factor. Also, there's something called Lynch syndrome, LYNCH, or hereditary non-polyposis colorectal cancer. These are also risk factors. And finally, race is actually a risk factor. So it's more common in African Americans and Ashkenazi Jews.
Wow. Oh, wow. All right. So the next question then is, what are signs and symptoms that we should look out for? Okay.
So there are some symptoms, and one of which is, say, blood in the stool that is persistent. Most of the time, bright red blood in the stool is from hemorrhoids, typically. But if somebody keeps having bleeding in the stool, then they need to be checked and make sure. Sometimes someone may not be able to see the blood, and actually somebody gets weak because they're now anemic. They've lost so much blood that they didn't know about. So anemia is one of the things that we have to look. This can cause. Other things is there's a change in bowel habits. So somebody, if it's diarrhea or constipation, that is persistent. I mean, we all have these changes in our bowel habits from time to time, depends what we eat.
Right.
But if it's persistent change, then that's also a symptom. And then one of the more common symptoms is actually abdominal pain. Again, we have pain here and there. However, if you have pain that doesn't go away, we also have to think of possibly colorectal cancer. And finally, people that have weight loss, unexplained weight loss, or unintended weight loss. And that can be a late sign, actually, of advanced disease. But I would like to make a point. You asked me about symptoms. Interestingly, most of the time, these can be asymptomatic.
Wow.
Meaning there's no symptom. And you're just feeling fine, and there's something growing, which is why it's important to start screening at age 45, so that hopefully, even if you find a polyp before it becomes cancer, you take it out, and then colorectal cancer is preventable.
Wow. Oh, wow. Okay. So the next question is, what are the diagnostic screening, or what diagnostic tests will let us know whether we have it or at risk, or,
Okay. So diagnostic tests are also the screening tests that I was talking about that we can do. And there are several types. And it's good we have options. That way it depends what somebody prefers. The first tests are what we call stool-based tests. The most common one is we call FIT test. F-I-T. It's fecal immunoglobulin testing. And it's little kit. You go home in the privacy of your bathroom, take a stool sample, put it, and then send it back to the lab, and they'll check it, and they'll tell you. Of course, you do that yearly. Okay. And if it's positive, then you have to do a colonoscopy, which is the next screening test that's available. Okay. So there's two tests, the FIT test. There's also the FIT DNA test, which is not as common. You do it yearly. So that's one test. The second test you can do is what we call flexible sigmoidoscopy, which is a scope is inserted, but it sees about 1/3 of the colon, not the whole thing. But you do that every 5 years is also good. Or you can combine the FIT and the flexible sigmoidoscopy. Then the other option is the gold standard, which is the colonoscopy, which is a scope they put through the anus, and it goes all the way and sees the entire colon. And if that's normal, then it's good for 10 years. So it's every 10 years for that one. And finally, with technology, there's new, less invasive procedures, which is called CT colonograph. Okay. Like a CT scan we normally do. But this is specific for the colon. So it gives you a 3-dimensional view of the colon. And you can see polyps or tumor in there. And if that's negative, you can do it actually every 5 years. But if it shows something, of course, you follow the colonoscopy to confirm and make the diagnosis.
Wow. Okay. So the next we want to know, when should we get screened? Okay.
Like I mentioned previously, the age is 45 years. 45. You start screening for average risk person. Okay. What do you mean by average risk? There's no family history, there's no personal history, and no genetic history, okay. And no the high risk of inflammatory bowel disease, okay. Or the genetic things we talked about earlier. So just average person, no risk factor. You start at age 45 and use one of the screening tests we've mentioned. But those who are at higher risk, like the things we mentioned, will start earlier. Depends on, okay. Yes, when the colon cancer was diagnosed or those things. But if you talk to your healthcare provider, they can guide you for those that are high risk. But for the normal average risk person, we'll start screening at age 45 years.
Okay. Now the next question, I think you've already kind of answered it, but I'm going to ask it just in case someone didn't catch it. But who is at risk?
Well, everyone is at risk, actually. Everyone is at risk. Like we said, there are people at higher risk, right?
Right.
So everyone 45 and older are at risk. Okay. But higher risk now is African Americans, okay. Ashkenazi Jews, okay. People with inflammatory bowel disease, Crohn's and ulcerative colitis, right. People with genetic risk factors, the FAP syndrome, familial polyposis syndrome, or the Lynch syndrome. Those are the high risk individuals, and even those should be screened earlier than 45. Yes.
Okay. So I think those are the questions that I think most people would want to know. So can you summarize everything? What are some key takeaways that we should, in case somebody wasn't paying attention?
Okay. So first of all, we need to know that colorectal cancer is preventable.
Okay.
So, and then screening does save lives. Okay. And we start screening at 45 if you're average risk. If you're higher risk, you start sooner. This your healthcare provider can tell you. Mm-hmm. And the idea is if you find a polyp and you remove it, it will never turn to cancer. And if you screen and you find a cancer early, you resect it, where the survival is much higher, over 90% survival. Okay. And then also, if you have higher risk, like I said, you start earlier screening. Then as far as prevention goes, our diet does play a role. So diets that's high in fat, high in red meat, those are not good for us. We need more plant-based diet. Diet high in fruits, vegetables, fiber, and also nuts and grains and seeds, so that the food moves easily through our system and don't sit there and then toxin build up, and it can lead to polyps and eventually to cancer.
Okay. All right. Well, that's it. So thank you so much, Dr. Cliff.
All right. Thank you for having me.
Yes, y'all. So we will be doing this weekly, like I said. Dr. Cliff has a lot of health information that he will be sharing with us on a weekly basis. So tune in if you are already subscribed. If you're not, go ahead and subscribe so that you can get the notification for the posts.
And also like it.
Yes.
And share.
Like, share, because this is important information that could actually save lives.
Yeah, life-saving.
So yes, this is going to be happening once a week on this channel. So we will see you next time. All right. Bye now.